You're watching Heart to Heart on ABC 27. Brought to you by Penn State Milton S. Hershey Medical Center.
And welcome back. Now here's the second part of Mel Saylor's story.
Madison.
Mel Saylor appreciates every day. That's because her life and her unborn baby's life were at risk. Mel had a C-section because her heart was failing. After Kiriana was born a month early, Mel's heart got worse.
They tried to do some more medications and stuff to control, to get the heart rate down, but nothing worked.
She continued to struggle, and we were in a situation where we had to jump in and do something.
We realized that the only way to save her was to get rid of her arrhythmia that was causing the congestive heart failure.
Dr. Mario Gonzalez knew the best way to stop her arrhythmia was through a procedure called an ablation. It's something he does every day.
We introduce catheters inside the heart through the veins, sometimes the arteries. We can record the electrical activity of the heart. Once we are inside, we can map and find where the problem is originating from. And once we do that, then we can deliver radiofrequency energy and eliminate the problem.
Mel's arrhythmia was gone.
Well, I could breathe better again. So I felt much better after that.
A huge improvement, but Mel's heart was still very weak.
People with weak hearts are at risk of abnormal heart rhythms, and she was demonstrating some of those rhythms.
Mel wore an external defibrillator vest home for a few weeks, just in case.
It can follow the heart rhythm, and it can set itself off if, God forbid, she should have a cardiac arrest. So we obtained this device for her to wear for a period of time until the heart had a chance to heal.
All right, put another scoop right there. Good job.
Mel's heart healed. The defibrillator vest was worn, but never needed. Day by day, Mel grew stronger. Now 3 years later, it's a memory, a vivid memory.
I guess my biggest thought is it's a reminder of how fragile life is. You know, we all think we have tomorrow, and we all, we don't necessarily know that.
And you can see Mel is doing very well. Now, after her first ablation, she did need to have another one. That's because her heart was beating faster than normal. But at this point, doctors say her heart is in very good condition. Back to you, Chuck.
Thank you, Deborah. Remarkable story. Now, Dr. Sammy, how successful was this ablation procedure that we saw there?
Well, it depends on the rhythm, but oftentimes the success can be 90 to 95% successful. In more complicated rhythm problems, it can be about 70 to 90% successful.
Is this a brand new procedure, relatively new?
It's been, I think the first ablation procedures were performed in the late 80s, and it's really improved dramatically our technology in the last 5 to 10 years.
I was going to ask what the other treatments are available for arrhythmia.
Well, aside from ablation, it depends on the patient's symptoms, but medications certainly can play a good role in improving patients' symptoms and outcomes. And also, there's occasions where implantable devices can be helpful in treating these arrhythmias.
Yeah, it gets better all the time, doesn't it?
Yeah, it does.
Seeing all the improvements. Well, thank you, Dr. Sammy, for joining us here tonight. And now what we want to do when we come back, for Arlene Rodriguez, the love of painting was the joy of her life until heart failure took it away.